Yeah.
With what? I'm sorry.
The Smart, the PFML, Symetra was the carrier there, but Patrick is who we've been working with over the past few weeks, and he's been great to work with, very responsive, and part of our job, and we work with hundreds of employers throughout Maine, mostly in Maine, but New England and across the country, and what we do is try to find competitive employee benefit solutions that are affordable. We hold the carriers accountable. We also take care of the accounts and the members that are under those policies, and so we really take pride in giving a hands-on approach to taking care of our customers, and so we've had success in helping other municipality, local government types, and we talked to Patrick and kicked the tires at looking outside the MMEHT Association plans, and so I have a couple slides to talk to you about those, and we found some. I'd say if we didn't find savings, I probably wouldn't be here, but we did find some pretty significant savings, and I think it's worth reviewing and talking about, and happy to answer any questions you have. I can talk forever, so please cut me off. I know I also put like 30 slides together, so we're not going to be able to go through all of those. But I just wanted to do a kind of an elevator pitch and a summary here, and then we can kind of dive deep into whatever you'd like to talk about. So I talked a little bit about my firm and how we support our customers. This is really a summary of costs, medical, dental, vision, life insurance, IPP, and then below is PFML, and then a total at the bottom here. We have a column that essentially would... Yes, go ahead.
I'm not really good at acronyms, so at least the first time through, can you explain what these acronyms mean?
Yeah. I was just going to ask the same thing.
Sure. So medical insurance, dental insurance, employee benefit plan, the vision insurance offered through MEHT, life insurance, accidental death and dismemberment. Those are those go together there. So and then IPP is what MMEHT, Maine Municipal Employee Health Trust, refers to as their income protection plan. The equivalent to that in the commercial market is short-term disability plan, or we have it as STD here. PFML would be a paid family medical leave. That's the upcoming statutory benefit program that is going to become effective May 1st of 2026. Employers were able to opt out of the pre-funding period early, and if their intention was to go private, Somerset County was one of those organizations, and so that's in that first left column there is kind of the description of the rows. The next column over, which says at the top, Somerset costs without any change, without doing anything, and just renewing as is with your Maine Municipal Employee Health Trust employee benefits, which are medical, dental, vision, life, and income protection. Those are the annual premium numbers, both employee and employer dollars, for the 2026 calendar year. I sectioned out the PFML because it is kind of a separate thing and it hasn't become effective yet, but I just did want to bring it forward in that you were able to utilize and get a lower, we were able to find a lower rate than what the state was offering. So in addition to being able to opt out of the pre-funding period early, instead of being charged 1% of payroll, you're charged 0.746 or something like that. I have more details on that, but you have a lower PFML rate with equivalent benefits. It's not like we're looking at watered down benefits that have to match substantially equivalent benefits. You've already realized the bottom row there, because you were able to opt out of the pre-funding, you've already realized $75,000 that would have gone to the state for that pre-funding program that you've kept in-house. So I just wanted to highlight that. The Acadia benefit options that I'm going to talk about today do have savings, and as you go down the list, the most significant is obviously the health plan. That's the most costly employee benefit plan. Dental also has savings, Vision offered through Cigna. We kind of did a package offer, but we can certainly shop that around if needed, but slightly higher. The same cost for life insurance, and then a short-term disability plan offered through Symetra, which would be your PFML vendor, is also coming in at some savings. And we like to pair short-term disability with paid family medical leave because those two benefits do integrate when they're with the same carrier. Any questions?
So Kevin, just to clarify, the top box, the full box with the 5 items in it, is what you could provide for us.
Yes.
The bottom 2 boxes are what you've already provided for us.
Yep.
So that combined savings isn't just for medical care, it's the medical care plus the savings we've already achieved
Exactly.
with paid family medical.
Exactly. It's
Thanks.
kind of taking a Acadia benefits package of what we can provide the county, both in 2026, but looking forward with the PFML program coming into place. So combining all that up, tallying it up, it has some significant savings there.
So we've already bought the car on the bottom, we haven't bought the top.
That's right. That's right. Yep. I want to talk about the health plan first because that's the bigger dollar item. And for the MMEHT renewal letter, it is association, your local government in that association, for renewal, 11.2%. Also had to water down benefits or adjust the benefits as used. Adjusting the out-of-pocket maximums, increasing the cost share for co-insurance for some of the plans there, and so they had to make plan design changes. In addition, the letter states that they did have to pull out more dollars in reserve, and they're actually paying out more in claims than they're collecting in premium. And so, no one is really protected, whether you're in an association or whether you're on your own. Associations, in some cases, when groups are running well from a loss ratio perspective, when your claims are lower than the premiums that are charged, you're really supporting some of the other organizations in that program. And vice versa, you can be in the other ship where you are running not so well, and then the other organizations could be supporting you. Healthcare trend is a real thing. It is impacting everybody. No one's really avoiding it. Particularly in the individual and small group market, they're getting 17, 18, 20% increases on average. And so healthcare trend is real. The association feels it. The commercial market feels it. And I just wanted to make sure that I address that, and so that I don't have a magic bullet to curb healthcare trend, but we do have some tools in our toolbox to kind of help, I think, kind of combat it a little bit. So. On to the next. I like to go over my marketing notes, what I did to kind of get where we're at today. We took the employee benefit plans out to market. We send out an RFP to the potential commercial carriers. And we initially had looked at the January 1st effective date. That is when your renewal date is. The most competitive carrier candidate is Cigna. Cigna is a large national carrier with a broad network and very competitive plans. At the time, we were comparing your 2025 rates to the Cigna proposal, and those proposals were coming in at minus 4.9 and another option at minus 6.8. Now, once we received the MMEHT renewal at 11.2%, we then took those numbers and just pulled them forward, and obviously when the snow gets deeper and you still at the same point, the difference between the two, is much greater. And so we had more significant savings when considering the 2026 renewal with MMEHT. Cigna is offering 2 proposals. One is a medical plan only, and one is also a bundle, medical and dental. I will say that we do have municipalities that have pulled out of the association and just pulled the medical out and left the dental and other lines of coverage in place. That's certainly an option. You don't have to pull everything out. We have a comprehensive proposal to do that, but you could just pull out the medical, for example, if you wanted to. Due to the delivery of the MMEHT renewal timing, They delivered it in the last week of October, and then they give a 60-day termination notice, which is October 31st. So they give you a week to decide whether you're going to stay in the association or not, because they require a 60-day notice. Due to that reason, what we did was look at a February 1st effective date, and I'll talk about what that means in a second here. For the February 1st, that should say 2026 proposal, Cigna added 1% to their rates, and so comparing a 12-month premium cost for your MMEHD plans, the Cigna option, we have options at a 13.6% rate reduction or a 15.3% premium reduction. I talked about plan year and benefit year and how Cigna's options are effective February 1st. Your deductibles and out-of-pocket maximums accumulate on a calendar year basis, and so at the end of every year, at the end of this year, your deductibles and out-of-pocket accumulators are going to reset, and you're going to start brand new. Cigna will actually credit your anyone that has met any part of their deductible or out-of-pocket amounts in the first part of January, or in January, just to make that person whole and not kind of reset that person just by making a carrier change. And so they're able to credit those deductible and out-of-pocket amounts because it's an off-anniversary move. And so your plan year for this year, if you decide to go with Cigna, the renewal date would be February 1st, and then it would run for a 12-month contract, and then it would renew January 31st. I have a grid here that just shows the actual numbers. Basically, like I said, there are two options with Cigna. They have one that is just without the dental. It's just the true medical plan option. That's the total 12-month premium, both employee and employer costs again. On the bottom there, we have Cigna with dental. They're kind of called these bundling offers, where if you get both the dental and the medical sell, then they discount that medical offer by another 2%. And so you get a deeper or steeper discount by packaging two lines of coverage together.
Discount for what?
Just from their initial offer. So the medical only proposal is a minus 13 point.
I thought surprised that the company would say, we'll provide medical insurance for X amount of dollars, but if you ask us to provide more services, we'll actually charge you less. Is that what
yes, it's kind of a...
Where's the catch? I guess is my...
It's a sales tactic.
Okay.
Anthem does it. Harvard Pilgrim does it. All the insurance carriers will do a certain decrement to a discount to add another line of coverage. They want to have a kind of a whole health type solution, and it's kind of more business for them, I guess. So that's just kind of a sales tactic on their part.
So Kevin, if I could just clarify, the big square in the middle is if the county took no action and just renewed with Maine Municipal Health Trust, and that would be an 11.2% cost increase to the county.
Yes.
If they were to go with the option of bundling the dental, that would be a 15% reduction off of the 11% increase. So that would be a net 4% deduction to the county's cost from 1 year to the next. Does that make sense?
Yes, exactly. So if you're the only thing there is that for the month of January you have that higher premium amount, but you're exactly right in that if we're comparing your rates today to the Cigna offer, it wouldn't be a minus 15. It would probably be like a minus 4.3%, something like that. So it looks like a much bigger discount because we are comparing it against your renewal numbers that at this point is the plans to renew with MMEHD.
So those are the two factors the commissioners need to consider. What's the net cost to the county, but also what's the net difference or change to the coverage for the employee? So I think you're getting there.
I am, yes.
So yeah. I think that's the other big piece.
Yeah, that's another big piece. Just another thing to note here is that it's very tough to do an apples-to-apples comparison because we're talking about different timelines. We're talking about one that starts on January 1st and one that starts on February 1st. So what we're doing is just taking 12-month time periods and comparing those two. What I do on the next slide is do an apples-to-apples comparison of a 2026 calendar year comparison. January is kind of a wash because we at this point in the year, you need to renew with MMEHD for January 1st, but you do have the ability to get out of the association for a February 1st effective date, and so that's where you're going to see the Cigna premium savings come into effect starting in February, and then we just drag that all the way down to December. I don't account for the savings that you will most likely realize in January of 2027. I just don't have that on here. I wanted to show you a 2026 calendar year month-by-month comparison, assuming enrollment numbers stay exactly the same every month, which they don't do, but we took current enrollment and applied those numbers all the way down.
And this is going to be the premium that starts February 1st.
Yes. Okay. And what I'm showing here is the medical and dental offering, not the medical only. Another piece here, and please stop me if I'm taking up too much time. I know you have an agenda here, but the other portion is that Cigna's benefit plans are a richer benefit package than what you're getting offered today. They have better plans from a out-of-pocket maximum perspective, and also better plans from a pharmacy copay perspective. Your current MMEHD plans today have two out-of-pocket buckets, is what you can think about that. You have costs that go towards your deductible and coinsurance. That goes into one bucket, and then you have another bucket for copays. Those fixed dollar amounts that you pay at time of service, those go into a separate bucket. You're responsible for both of those, and you're not really off the hook and you haven't hit your total out-of-pocket maximum until both of those out-of-pocket maximum buckets have been filled up completely. Then the insurance company is responsible for paying all of your health insurance costs for the remaining of the year. So for your most popular plan, the Baxter Point of Service 200, you have a $4,150 copay out-of-pocket maximum bucket. This is for 2026. And then you have a $2,350 coinsurance, deductible and coinsurance out-of-pocket maximum bucket. So the total member responsibility is $6,500 for a calendar year. Okay?
And this is not a deductible. This is
deductible costs go towards that. Deductible and coinsurance costs will go towards that coinsurance. It is not. It does not go to your coinsurance out-of-pocket maximum. Apologies. Let me restate that. Deductible expenses do go towards your coinsurance out-of-pocket maximum, but you do have inpatient, outpatient care. I have a detailed benefit summary of what deductible and coinsurance expenses go towards that specific bucket. But your $200 deductible on this plan is part of that coinsurance out-of-pocket maximum. The reason I have a note here at the bottom, why did the plans and plan names change for 2026 instead of actually saying it's a Baxter Point of Service 200 and just calling it now Baxter? I believe they're just leaving room to make those deductible changes in the future and increase that deductible from 200 to 300 to 400. So they did change the name, and that's kind of me reading the tea leaves of future benefit changes to come, potentially. Cigna's out-of-pocket maximum is very simple. It is one single unified out-of-pocket maximum where your deductibles, your copays, and any co-insured expenses go into one bucket, and that overall out-of-pocket maximum where we match the plan designs but have improved the out-of-pocket maximum, the total member responsibility on this plan is $1,700 compared to the $6,500 on the MMEHD plan. So I have details here on the three plans that you're offering. You have a zero deductible plan. I highlighted the biggest benefit differences here. You have, again, on the MMEHD plan, two out-of-pocket maximum accumulators, where with Cigna, you just have one. So on the zero deductible plan, you have a $1,500 out-of-pocket maximum. On the MME HD plan, you have the $6,500 out-of-pocket maximum. You'll notice down at the bottom, we have prescription drug copays. Under your current plan, it's a 5-tier copay structure. Depending on the cost of that structure, it could be brand name, generic, specialty medications. Depends on what the cost of that drug is. It's going to fall into a different type of tier of costs. Under the Cigna plan, we're matching the first 4 tiers and then stopping there. We're not adding a 5th tier. So if someone's taking a high cost, maybe a non-preferred brand name drug or a specialty medication, they're going to pay a $150 copay under your current plan. Under the Cigna option, they would only pay a $60 copay. Hopefully that makes sense. And please stop me if I'm.
On the prescriptions, do you have preferred pharmacies, or any pharmacy will do?
Yeah, and almost all the pharmacies in Maine are going to be under the Cigna network.
Okay.
We have plenty of large customers with Cigna and don't hear of any issues there. I do have a bullet point that talks about the network coverage between Anthem and Cigna, and the overlap is virtually 99%. It's all providers, 99% of providers in Maine, all the hospitals in Maine, and then the pharmacies we don't hear any issues on, for sure. But better copay structure. I would say, just honestly, whenever you're making a carrier change, the biggest disruptor that we ever see is on the prescription side, because people know what they're paying for their drug today, and sometimes the drug will move from one tier to another, maybe going from a tier 1 drug to a tier 2 drug, or maybe on the other way around, they go from a tier 2 drug to a tier 1 drug. But certainly, if they're taking a high cost specialty or brand name drug and paying $150, then they would now be paying a $60 copay.
Well, even in lower tier drugs, some companies will have a preferred pharmacy where that drug might be $0, but if you go to another pharmacy, it would be $12. I mean, it's not much, but it's something.
Sure.
I was just wondering if that's the same.
Yeah, I'm happy to look into that. I'm not sure if your current structure is that way. I know that there are certain plan designs where there are preventative type drugs where you can get much lower copay type costs. And certainly there are cost transparency tools. You can shop around, and there are cost saving programs that are available to make sure that people utilize and you get the best bang for their buck.
So there are preferred pharmacies then?
It is just one standard Cigna pharmacy network. There's no preferred or not. There's no 2 tiers. I know that Anthem on the commercial market does have a tier 1 drug for tier 1 pharmacies and tier 2 pharmacies. So tier 1 could be Hannaford, Walgreens, and then tier 2 could be another set of pharmacies. With Cigna, it is just one network of pharmacies. There's no preferred in tier 1 or tier 2. It's just one.
Thank you.
Yeah.
As you get to this slide, Kevin, I'll just note that for the commissioners, this is the slide that the majority of our employees use.
Yes.
They utilize the $200 deductible plan. If they want to pay up for the zero deductible that was on the previous slide, they can do that. But this is what the majority take.
So this slide flows the same way the prior slide does, in that we're kind of matching your plan designs. I will say that for deductible and co-insurance expenses, you'll see inpatient, outpatient, high-tech imaging. That's where you want to use that cost transparency tool to make sure that you're going to the right spot if it's a planned type of service. But we're matching these plans across the board, except for where I highlight to show that the total out-of-pocket maximum is significantly lower, and then we have a 4 copay tier structure instead of a 5. And then we have the last plan here. I won't go through it just for the sake of time. I did ask Cigna a few questions, just trying to anticipate some of your questions, and hopefully these answer most of them. But Cigna's network is extremely comparable to the Anthem network. It is also a national network, so if you're in California, Florida, wherever in the United States, Cigna has a vast network. We have customers that have locations all over the country, with Cigna and don't hear any issues at all. So very comparable, but specifically in the state of Maine, all hospitals are covered, and then they cover 99% of physicians. They typically release the renewal 90 days out from your effective date, and they don't have a 60-day termination type thing where you need to, have to be kind of under pressure to make a decision on a carrier change. In the commercial market, we can make carrier changes almost up until the very last moment, and so there's nothing there on that. Cigna is a very good carrier from a customer service standpoint. Their customer service metrics, their average speed of answer is 45 seconds, and they have a 3% abandonment rate, so I think that's pretty good. Whenever you talk about, concerns about moving out of an association, there are, questions about, well, what about year 2? What about year 3? I did ask that question, what is your first year renewal retention rate? How many groups do you renew on that first renewal? And they have a 90% renewal rate. That being said, if you were to jump into this Cigna option, our job is to make sure that you have the best and most competitive option available. And so we look at other carriers, United Healthcare, Anthem in the commercial market, Aetna, Harvard Pilgrim, Community Health Options. These are all carriers that we're very familiar with, and we do a network comparison on that. But also I would say that, just doing this doesn't limit your option to ever go back to the association if you ever decide to do so. But they do have a strong persistency rate. When we talk about how you're rated in the association, you're blended with other municipality and local governments in that association, but they do look at your claim experience. They see how well are you running from a loss ratio perspective. It's very similar for your group size in the commercial market in that they don't consider you 100% experience credible. They're not going to look at your experience and base their renewal 100% on how you're running. What they're going to do is blend you in with their manual or their block of business. And so for a group of your size, I ask the question, how much do your underwriters consider your experience for a group of this size when developing the renewal? And for a group of Somerset County size, which is about 67 employees enrolled, they think that you are about 40% experience credible, and then the other 60%, they're going to blend it with your block of business. And so it is a good protection and an association rating structure in that in years that you're running well, you may not get a minus 15. You're going to be blended in with their block of business, which is running around trend.
Can you give me flesh out a concrete example of this procedure and how it would play out?
Yeah. So
what are you talking about here?
Yep. So let's just say your claims for the 2026 calendar year, or what they're using to rate your plan, were $1 million. They would pull that down and account for 40% of that when they're developing their renewal. They also have their block of business that they run, and it's usually around trend, around 7 to 10%. And so they'll take that block of business, that manual, that factor, that underwriting factor, and they'll blend it in with your experience, but they're only going to say that you're credible about 40%. Your experience is 40% credible. They're not going to look solely at your experience. They're going to blend those two numbers together to develop your renewal.
Is this a good thing?
It is a good thing it is a good thing, and it's how your association works for the most part today. Mm-hmm. In that, if you were to run,
so if you had a really bad year,
if you had a bad year, it would protect you. Exactly, it would protect you, and they're not going to base all your claims and just say, oh my gosh, they ran at 150%. We need to give them an extremely high renewal this year.
Like my car insurance.
Yeah. So they
just grading on the curve.
Yeah.
Well, if I could just give some context there, we had a couple of bad years where the premiums we paid in were $1 million, but what they paid out was $1.4 million. And so we ran 130, 140%. over. That's a negative, right? Year to date this year, for 3 quarters, we've paid in $1.14 million in premiums, but they've only paid out $700,000 in claims. So we're running about 60%. So that is the performance that is based on 40% of our renewal.
That's right. Yep.
So we're doing better, but part of that doing better is our rates have gone up 20%. So we're paying more in premiums.
And from a Cigna underwriting perspective, I'm just kind of showing you behind the scenes and how they rate these things, and how they would look at your group specifically. They have what's called a pooling point. If you're familiar with self-insurance, it's kind of like stop-loss coverage, but it's called a pooling point, and any high-cost claims over $100,000, let's just say you have a claimant that is a $500,000, totally legitimate, that happens all the time. They're not going to take that $500 and apply it to their renewal. They're only going to account for $100,000. The remaining $400,000, they're not going to account for that when they're developing your renewal. It just protects you from catastrophic type claims like $1 million claims, which do happen, unfortunately. So it's kind of a high. And they do charge for that in their rates, but it is just kind of a nice underwriting protection there. Your plan designs, there are different types of plan designs out there, HMOs, PPOs, point of service type plans. You have what's called an OAP, or Cigna calls it an Open Access Plus plan. Very similar to a PPO type plan, where you are not required to select a primary care physician. Some plan products, like HMO plans, require a PCP designation. Also, you're not required to get referrals to see specialists, so that is another nice, it gives you freedom to go where you want, when you want, and then also you have in and out of network coverage as well, just like a PPO type plan. So it is a complete freedom of choice in your provider. Obviously you want to stay in network, but you don't need to, you're not required to select a primary care physician, even though we recommend doing that. And you don't need referrals to see specialists, even though in reality you probably need a referral anyway. Sometimes specialists just require this, but they're not required under these plans. Cigna has a bunch of great tools to manage claim risk. They don't just sit back and see how a group's running. They do try to manage cost, and when you're outside of an association, it does give you more plan flexibility to adjust plan designs if needed, adjust funding models, implement wellness programs. There's also a robust claims management and care management program. So if you're someone that needs care management, there is a care manager that is assigned to you from Cigna, and they'll work with you to make sure that you have the care appropriate. So they do have some great programs surrounding these core benefits. ID cards, standardly they provide them digitally, but you can also order hard copy ID cards. That is it. I'll kind of pause here because I've been going for a little bit now, and I just want to be respectful of everyone's time. That was the biggest ticket item. Yep.
Well, from what I'm hearing, it sounds like a good deal. I think we should do it, but I did have some questions. One is, are there other counties that do this or similar institutions?
Yes. Yeah. We work with York County. They are out of the association with a different carrier, but they realized savings. And,
with Cigna?
No, they were with Harvard Pilgrim, actually. Or they are with Harvard Pilgrim.
So what are we buying? Are we buying you or are we buying Cigna?
You're buying, so I am the middleman between the insurance companies. I work with plenty of groups that have Harvard Pilgrim, but I also work with plenty of groups that have Cigna and Anthem. I don't work for any insurance company. I'm the broker that finds the best plans and rates and then helps roll them out. So my job, I have a team, not just me. I have an account manager, an employee advocate that would help support your members.
Do you know of any counties or other similar institutions that have bailed on Cigna? They don't like it, or it was a mistake? Or?
No, I don't know of any. I do know that all good things must come to an end, and we have certainly had customers that have had Cigna and left for others due to like lower costs. I wouldn't say ever necessarily for service-related issues. I would say part of our job is to, if it's the right fit, market the plans aggressively to make sure that we have the best options for our clients. And so it's not uncommon for a group to stay with a carrier for 2 to 3 years and then go to another carrier and stay with them for a year or two, and then kind of move around. That's just kind of the name of the game, at least, in our world at least. Yeah.
But you said something at the beginning. So if an employee has some big beef with their insurance coverage, they call you or your organization,
yes,
or they call Cigna?
Yeah, they call us. I would prefer that they can call Cigna first if they want to listen to elevator music for an hour. Certainly they can do that. But we have an employee advocate service that has a direct line to our Cigna reps. It's not members don't have access to that representative. They would reach out to what we call our employee advocate service, and it is a free and confidential service. So it is a nice firewall for you and the team here. When someone comes with a personal health insurance related issue, they can reach out to that employee advocate. That issue stays confidential between that individual and the employee advocate. Then they work with the provider, the insurance company, to get that issue resolved in a timely manner. So sometimes what will happen is maybe they need help with finding a prescription or getting a prior authorization, or they'll get a bill in the mail from their provider and it doesn't line up with their explanation of benefits. That's kind of a red flag to say, hey, something went wrong here. They reach out to our employee advocate and they help them work through that issue. So we advocate for the client. We don't work for the insurance companies. We advocate for you and your members. I would help Patrick out and any others from an administrative side of things. We have a lot of tools in our toolbox for the account side support, but member support I feel is just as important. That's what we're putting these programs in place for, is for our employees. And so if they're not happy, it's something's broken. And so we really do like to take care of our members and have that member advocate support.
So, how did you land on Sigma rather than Harvard Pilgrim for Somerset County via York?
Yeah, Cigna has been very competitive. Some carriers will take a look at a group's how we market our plans. I guess to start, just to take a step back, we send them claims information, member information, and then they run their tools and they develop those rates. And some carriers have factors for certain types of demographics, and some carriers are running better from a block of business standpoint than other carriers. For example, you may see some things in the news related to Harvard Pilgrim, for example, where they may be in financial straits, for example, versus a different carrier. And so what I would say is that every year is a little bit different, where you'll see a carrier that gets a little bit more competitive than another carrier, and there's no one dominant force in the marketplace. It really varies year to year. Back before this year, in the individual and small group market, the carriers file what we call rate factors, and they, more often than not, all the small groups would move to that carrier that issued the lowest rate factor. And then the next year, Harvard Pilgrim would issue that lowest rate factor, and then we'd see all the small groups move to them, and then Anthem, and then CHO. And so it really depends on how their block of business is running that year and how aggressive they feel they want to go after a group. They think that there's a good opportunity in this space, and so they do also have a lot more plan design flexibility than Harvard Pilgrim, where they're able to match plan designs a lot easier than I'd say some other carriers that have pre-canned plans that have a little bit harder time mapping plan designs. Hopefully I answered that question, but it is variable. We did send it out to market. I believe Harvard Pilgrim at the time, when we did send it to market, came in at a rate hold. So they were matching your 2025 rates, and I was like, they're not going to move for no rate reduction, but Cigna did come in lower. So they were the primary carrier that we kind of led with.
What I was asking, why you landed on Sigma rather than Hubbard Pilgrim?
Yes, yeah.
Yep. Okay. Thank you.
Yes.
Gentlemen, any other questions, comments?
Thank you. Just one follow-up. Can you ask Cigna to provide any municipal accounts that they have in the state of Maine?
Sure, yeah.
And not to be too intrusive, but what does Acadia charge? What is your fee structure for being the broker?
Yeah, so you won't see a line item from us. We get charged from the policies that are in place. We get paid by the insurance carrier, so our commission is built into the rates on those plans, and so every plan is a little bit different. And so but we're also we're required to disclose what we are making on plans, but we don't charge a separate line. You wouldn't see like a separate broker consulting fee on there.
It's like an old-fashioned travel agent.
Yeah, it's baked into the rates.
Yeah.
Exactly.
Okay.
Yep. I would say that the one thing with timing where we kind of ran into a bit of a issue before was we weren't able to get to the January 1st because of that 60-day notice, and so I would say we have until the end of this month, basically, to decide to give notice to the municipality. From there, we have plenty of time to transition members over to the new plans if that's something that ends up happening. So, I have plenty more. I could talk for another hour. I know other people have things to talk about, so
We're going to crowd that.
yeah. But there's definitely all the information is in that printed out packet here. And please reach out to Patrick, and if you have any follow-up questions, I'd be happy to answer them.
Thank you very much.
Yeah.
Thank you
I
very
was
much.
just going to ask Patrick if you had any comments, criticisms, praises about this particular package.
No, other than go back to John to say, I have no idea if it will go up by 20% next year.
Well, yeah. We know what's going to happen next year.
Well, I can actually, if I may, just talk to that for a second. If we're down here at minus 15.3 and your renewals at 11.2, next year healthcare trend is not going away. I can almost, it would be safe to say that the trust would probably issue a 7 to 11% renewal increase the following year. So for Cigna to get from minus 15 and then to account for your 2027 renewal, they would probably have to issue around a 30% increase to get you back level where you'd be for the 2027 plan. Just from that perspective, I would say that your minus 15 compared to your renewal is pretty significant. We don't see that a lot, the delta there. And so even if Cigna did charge, renew at trend at 12%, you would still be well below what you'd be with under the association.
And we'll be looking at that again this time next year anyway.
Right.
Yes, exactly. Yeah.
But I would say that if you do decide to go after the new plan for health insurance, I would also, at a minimum, go with the dental also.
Yeah.
Oh, yeah.
The dental plan gives you an additional 30,000 savings on health insurance, but also adds an additional 30,000 savings by the dental itself. So that's a 60,000 impact. We just said that.
Okay.
Good. Thank you.
All right,
All
thanks.
right, we're all set.
There's a lot of BTUs.
So now we have our second workshop was a presentation of the fall 2025 matching grant applications. And as we go through them, if there's anybody who is representing that grant application that wants to speak, please don't hesitate.
You're here for a grant. This will help you follow along with what the commission meeting.
You're all set. If they have any questions, they'll filter them through you.
Okay.
All right, thank you for coming up. Absolutely.
So as Commissioner Cizak said, this is the first view. I have The detailed applications have been reviewed, and actually they have them on the desk there. What you're looking at is a summary of the 14 applications that were received by the deadline. Before we do a quick review of each application, I just would note where we stand as far as the fund balance, and that's on the top of this sheet here. Your current balance is about $587,000 in the Community Benefit Fund. Of the matching grants that have been previously awarded, there's still about $140,000 that haven't closed yet. And I will say that for the fall of 24, we're almost done. There's only one outstanding grant that hasn't been funded for the fall of 24. So right now, the only open periods are the spring of 25 and then this one, the fall of 25. As you're aware, the commissioners have committed other funds from community benefit to the tune of about $250,000 to the Moose River Jackman Fire Department, and the last $50,000 payment to the Skowhegan Humane Society, Somerset Humane. So that brings your adjusted balance down to about $197,000. So just in perspective, this round has a total ask of $179,000. I would anticipate, Dave, how much coming in at the end of the year for our community benefit payment?
Around $360,000.
Okay. So there's another $360,000 coming in to replenish the funds December, January timeframe. And that will go on for another 9 years, just to give you your perspective about that estimated income.
And they don't.
Right. So I will say just a quick comment of reviewing these. We had a couple that I would say are first-time grant writers, and so their applications were a little hard to follow. We had several from municipalities, and the criteria that you're trying to hit for these grants are hitting certain things like public safety and public health, trying to offset taxation, cultural, historical significance, that sort of thing, outdoor recreation. I will say, from my perspective, reading some of the applications that came from municipalities, they kind of lacked in hitting the scope of some of those projects. So, with that being said, the first one is from the Irving Tanning Community Center. I spoke with Chris Littlefield, the town manager in Heartland. He gave me some background on this group. They've been around for several years. They are a standalone 501c3. They've inherited an old school building in Heartland, and that is used for a variety of reasons, a variety of purposes, but also the selectmen in Heartland use it for their meetings and for their town meetings, because there's a pretty good-sized gym in that facility. They're looking to replace a door that no longer locks properly. It's a large glass door. It's a pretty good-sized project cost of about $22,000. Their application asked for a $15,000 grant, but that doesn't meet the 50-50 criteria. So the max that they would be able to receive is half of the cost, or about $11,000.
I have a question.
Yes.
We're not saying yay or nay on these today.
Nope.
We're just kind of familiarizing.
Right. And
we're sort of acting like the old committee we used to have.
And
kind of pre-screening or screening.
I did send this information out to the committee members, and I did get some of their feedback as well, so we can take all of that into consideration. But yeah, to your point, you're not looking for a final decision. That'll come out at a future meeting.
But we might be giving you directions to take back to these people
Yep.
to say where we're at.
Yeah. Thanks.
As a 503C, are they tax exempt?
Yes.
This is, yes, the community
Okay,
center.
because I noticed that on the quote from the glass people, they put in sales tax.
Yeah.
So they can
Yeah.
save that amount.
And I would add on this one, I think we should stick with our policy, which is a matching grant. And if the town is using this facility as well for public meetings, et cetera, they can kick in the missing $4,000. That would be my attitude on that. I think we should stick with our policy.
We're definitely sticking with that policy.
And I would ask, because I don't know everybody that came in, is there anybody here for this application?
Tim? The only thing I would share is that we've been working with the town of Heartland to identify a shelter in Heartland, and this building is the building that we're looking at to designate as an emergency shelter. So,
Thanks, Mike. Any other questions or comments on this application? All right, number 2. The town of Bingham has a corporation, a development corporation, and they are looking to enhance kind of the historical nature of their area. They've joined forces with the Old Canada Road Scenic Byway. They want to create some interpretive panels. You've probably seen these anywhere you travel up and down historical places. They've got a overall project to try to put at least 4 sites at a total cost of $35,000. They're seeking a grant of $12,000 for this project. I don't know if Drew or anybody from Bingham is here for this. I don't see anybody. Any questions or thoughts on this one?
I like the bench idea because it makes it more of a little rest stop than
Right.
simply getting out of your car and reading something.
Have they reached out to the tourism? I can't remember what they. Have they reached out to the state tourism? We give the tourism committee money every year, and they disperse that. Is there anything there they can capture for this project?
That's a good possibility, but my experience with the Kennebec Valley Tourism Council,
Yeah.
which is what we support, is if they do grants, they're on the small side of $1,500, somewhere in that neighborhood. All right, the third application is from the Skowhegan Federated Church. For many years, they've been doing Christmas gifts for families. I did get an email from the person that put the application in, and they wanted to clarify their budget, but I didn't get a chance to get a response back from them before we started the meeting. I put in a budget of $20,000 because they had based their request for $10,000. I wanted to clarify if their budget was $10,000, then the match would be $5,000 if they were eligible for that. So they are simply seeking funds to help purchase the items that they put together. They did tell me that this year they're planning to do 700 little gift packages, gift boxes, if you will.
Well, their cover sheet suggests $10,000 for the total cost, so it would be a $5,000 matching grant.
Right.
Yeah.
Number 4 is from the town of Solon. They maintain an area on Falls Road known as Williams Dam at Caratunk Falls. If you go back in time, that was called the Ledges, where kids used to go and jump into the deep water there before mean old Brookfield gated the whole thing off so you can't get in there anymore. So probably a liability thing. They have a area there that the town maintains in their FERC agreement, and they would like to create signage, improve the road, create a larger parking area, picnic area. This is one of the only official trail parking areas between North Anson and Bingham on the Kennebec Valley Trail. The town's looking to put in about $55,000, and they're seeking help to the tune of about $15,000. Any questions or comments? I don't believe there's anybody.
An overall comment that people realize that provided the grants, they don't receive the monies until after the grant is completed, and we receive the fact that the grant has been.
The project's been completed, and we get invoices back to show that they've spent the money.
Exactly.
Correct. Yeah. The next page, number 5, is from the town of Anson. When many of the railroad tracks were taken up to create the aforementioned Kennebec Valley Trail, they did not remove them. The state did not remove the tracks on town roads, and so Anson is hoping to do that on certain town roads. Essentially, that would maybe alleviate any of the rails that push up during the season. You catch your plow on it. This is a $30,000 project. They're asking for $15,000. Most of the cost of this project is repaving the area.
It's a worthy project, but this seems to fall into the category of what a town usually spends its taxpayer dollars on.
Right.
And
And so when they made their application, that, if looking at the criteria as far as outdoor recreation and that sort of thing, the only box that they checked was to save taxpayer dollars. So, and again, this is an ongoing education process that scope, the scope of the project, how many people it impacts, what area it impacts, is something that everybody needs to consider. So,
and also not just routine maintenance.
Right.
So the same town, I think, had a request in the last go-round to put in a new floor in the town office, and I think we had the same approach, though. We thought, this is not really what we're doing with this program.
right.
The other thing I found missing on that application was the what they would recoup from the rails.
Yeah,
The steel.
yeah. I had that same question as well.
Maybe we'd get the rails.
Next one, number 6, and we do have some folks here from the Palmyra Boosters Club. They received a $15,000 award in the fall of 25, so just about a year ago, to do pickleball and tennis court improvements. That project is essentially done for this year, and so they've sent me the invoices, and that's actually on your agenda later to award that, approve that from last year. This is the kind of the next phase to the project where they are looking at adding playground equipment. Do you have any questions or comments on that application?
Well, if they just had an application, don't we usually?
1 calendar year. So they were approved in the fall of 24, and so now it's been a calendar year. Yep.
I guess if someone's here, how'd the improvements go to the pickleball court? I mean, how's that looking? Pretty good?
The blacktop and hot top were put in, and the company that we hired, they first originally told us that they were going to be here in July. Well, they didn't do it until last month, and then the second phase of that project had to do with the painting of the lines and sealing the blacktop. Well, because of the temperatures and everything, our concern was if they painted it, are they going to stick behind it? And they said, well, they recommend we paint it this spring.
Mm-hmm.
So we kind of had to push that back a little bit. That's what happened with the pickleball/basketball court project.
Thank you.
Oh, go out of bounds on the pickleball.
Everything's in. Number 7 is from Ben Toll and the Forks Area Trail Club, and they've got a 60-foot bridge that is failing. The cribbing is rotten out on it. The wooden decking has fallen off. They want to replace it with concrete abutments. That's a project of about $14,000. They're seeking a grant of about $7,000. In the fall of 24, just so you know, this trail club received a grant of $14,000 for groomer repairs.
Is this just snowmobile or is this ATV too?
This, I believe, is a year-round trail.
I don't know.
Is there somebody here from?
I don't believe Ben is here today. Number 8 is the New Portland Lions Club. They are replacing the electrical infrastructure at the New Portland Fairgrounds, replacing some very old wiring that's become cost prohibitive and unreliable. It's a total project cost of $55,000. They're seeking a grant of $15,000 to go toward their project. Is anybody here from? Hey, fantastic. Right.
Gentlemen, thank you. Any questions?
What is your
My name is Ron Nunes. I'm a member of New Portland Lions Club. What we have is as some of you may know, we've got an infrastructure there with full transformers back in the days of PCBs and all that sort of stuff. And some of that stuff we want to obviously eliminate for environmental reasons, first and foremost. Improve efficiency. It costs prohibitive to pay the electric bill every month because these things draw power because they're not, as they would be called today, smart transformers and that sort of stuff.
What are the fairgrounds? Do the fairgrounds just used for the fair, or does they have other use during the year?
There are multiple events that take place. We have demolition derbies now. We have mud runs, truck pulls. there are also, well, believe it or not, it's becoming quite a wedding venue. We've had several weddings there. At our own expense, we built a new food court, a new food facility there. We've built a new addition to that, which is soon to be our clubhouse. We transferred funds. We sold a building in the East Village, New Paltz, and transferred, used the funds for that.
And this would modernize the entire electrical system for the fairgrounds.
Well, sir, as you can see in the proposal that I made, and I hope it wasn't one of the ones that was shot.
No, it's pretty
Oh, wicked.
In the proposal that I made was, we phased the project because of the difficulty raising funds. And our cash on hand, if we had the $15,000 grant as I requested, we have an amount of money that would get us to a point that the first 2 phases of the project would be completed. And then we could, in ensuing years, we could plan on another attempt or another possible grant source or something like that to finish the project. But that's why we constructed it in such a way that it would be a phased project, so it would be easier for us to keep it moving.
On the removal of the old infrastructure, will there be any wiring or metals that you'll be able to recycle and recoup some costs on?
Unfortunately, sir, what we've got to cope with is disposal of hazardous debris, which is another problem that we have to absorb during this process. So, any value? No. It's going the other way. It's going to cost us thousands just to have to cope with that. We're hoping to, my next goal would be that if this were to come to fruition, I'd like to approach the EPA or something like that for some grant monies to help us dispose of that stuff.
Yeah. Thank you.
I thought I'd seen in the application you had mentioned it, there's a safety component to this as well.
Yes, in many cases, we've had multiple failures during actual operations of the fairs, that sort of thing, where we've had to immediately bring in bucket trucks and try to restring wire or try to repair a transformer or those types of things. So you can only imagine what kind of stress we're under when you've got a bunch of little kids running around and you got a transformer wants to blow off the pole. So we're kind of similar to that. And we do have a formidable group of people, when I say well-skilled, so our in-kind services are going to be a substantial assistance in
Well, it sounds good to me, and I'm speaking as one who attended a Dick Curlis concert there in 1974. Probably the only person in this room, and I have very fond memories of many visits.
You'd be surprised that there is discussion right now on creating a music venue there.
Yeah, I remember it well.
That was before electricity was.
Yeah, we all had our torches.
Yeah, the megaphone running in the cave.
It was a great evening.
Thank you very much.
Thank you, Joe.
Also in New Portland, the town of New Portland is seeking funds to propose an addition on the town office, and this is an addition primarily for document storage. And so that's a $45,000 project, and they're seeking a grant of $15,000.
I have the same beef as I had with the one in the town of Anson. I just think it's kind of I'm all for saving taxpayer money, don't get me wrong. We're trying to maintain some consistency with our grant stuff. I think we kind of moved these to the side a little bit.
To me, it goes to scope. What's the scope of the project?
Right.
So, number 10 is Little Wonders Daycare, and located on Jones Street at a former dental office site. The building was purchased and refurbished a few years ago and currently enrolls 52. The expansion of the site will allow for an additional 20. Project cost is $102,000. They're seeking a grant of $15,000. Now I will say, I know that Lindsay Cool is here, and sometimes you ask this question. So this is a for-profit business, and what I tell people, until you tell me to stop taking applications for for-profits, it's still out there, because every once in a while you hit a for-profit that has a scope, that has a benefit. But for the most part, I do warn people that these commissioners will prioritize nonprofits over for-profits. So that's my little disclaimer to you and to the rest of the group.
And my question is, how many people do you serve in the greater Madison area? Besides the 50, but how many, there's Madison people, but outside of the Madison area?
90% of my...
Could you identify yourself?
Yeah, Lindsay Cole. I own
How you doing?
Little Wonders.
Thanks for coming.
90% of the children that attend Little Wonders are from out of Madison. I have people that come from Winslow, Oakland, Canaan, Athens, all over. Sometimes up in the Forks, I get children from up in the Forks as well.
This seems huge to me. I was not aware that daycare centers were this big.
Well,
Are you going to be hiring additional staff if you have another 20 children?
Yes, 3. There'll be 3 more staff. Currently, I have 7.
So you have 10 total.
I would have 10 then.
Because of the nature of the business, have you sought out or looked into any other type of grant situations for this?
I have. I do have Christian Savage looking into other grants, but I've not had a lot of luck.
Do you have any kind of, what's your fee structure like for weekly daycare there?
So full-time, I take ages 1 to 13. So ages 1 to 4 or 5 years old is $200 a week for full-time. Mm-hmm. Part-time is $50 a day, and how I break that down is 4 to 5 days a week is considered full-time, 1 to 3 days is considered part-time. Mm-hmm. I do have a considerable amount of before and after school kids too, because there's nothing for an after school program in Madison. Mm-hmm. This big room would be for the before and after school kids.
Does any of the project involve either safety improvements or ADA handicap accessible components to it?
So the entire daycare has to be ADA, accessible, handicap accessible. That's the fire marshal's requirements. I have 3 bathrooms currently in the facility, so I don't need another bathroom. That's per the fire marshal's requirements. And they are all handicapped accessible. The doors have to be, I wouldn't be licensed. I wouldn't be able to be licensed if I didn't.
State mandates.
It is, yeah. And actually, to be completely honest, the fire marshal really rules well over the state. Whatever the fire marshal says, the state goes with.
So you said you've been in discussions with Christian about a loan?
Just yesterday about grants. He's looking into other grants that may be available to me. I am paying for the entire project out of pocket. Mm-hmm. I am.
Is this like are you the sole proprietor?
I am.
How long has it been in business?
I've been doing, Little Wonders has been in business for 27 years. Mm-hmm. I did start in Bingham and moved to Madison 20 years ago.
In the past, where it's been for-profit organizations that are looking for money, we've often recommended that they try to get we're all for getting low-interest loans and supporting those if they're available, usually through SEDC or some other institutions.
I did go that route. Mm-hmm. When I first bought the building, I did go that route, and Christian, the SEDC, they helped me tremendously.
Yeah, that's good.
They're wonderful, absolutely wonderful. I was talking with several people in the town office in Madison, and I was recommended to try for this grant.
Yeah. Okay.
Number 11 is the town of Skowhegan. They're looking to upgrade the security system, access control, camera systems, so forth. It's a $21,000 project, and they are asking for a little over $10,800. Just as you know, the town of Skowhegan received $15,000 a year ago to do very necessary improvements to their IT system. This sounds to be like a next phase of that type of work.
Does this mean the town of Skowhegan is going to do what we do and put up a lot of glass doors and
It does.
Controlling access.
It
that
does say
sounds-
access control.
Well, I'd have the same beef with this as I do with the town of Anson, and what's the other one I was complaining about?
Newport.
Okay, yeah. Seems to me they-
Roofing and the whole nine.
Do you agree with me on Joel? Am I out of line on that, Joel? Is there some consensus here on what I'm?
No, you'll sleep well tonight. I agree with you on that.
Sleep well. Okay.
Number 12 is Skowhegan Main Street's Youth Summer Learning Series. Christina Cannon, I believe, is here. And so this is a $52,000 project which provides adventure-based camps, gear, meals, transportation for up to 70 local students. And they're seeking a grant for $15,000. Just to let you know, they did receive a year ago $15,000 in funding towards their Kitchenette 185 Main Street project. Actually, that was 2 years ago, in the fall of 23. Do you have any questions or thoughts on this one? And Christina, do you have any information you can pass along? Is this why you're here, or have I missed the vote?
Oh, no, I was
Okay.
here in case there were questions.
Do the kids have to leave their phones at home? That's what I want.
I think most of them actually do. I don't know. This will help us expand to 7 weeks of programming. We're adding a new fishing camp as well. And this is largely to cover the cost of transportation and food and access to places like Maine Hudson Trails up in Lexington. So we're going to be spreading the wealth out around the county too. So people will be headed north up into the county with our youth. But also these programs are open to any youth from the area who want to join, and they are entirely free.
Number 13 is some energy efficiency upgrades for the East Madison Historical Society. They're seeking a grant of $4,000 for about an $8,000 project, insulating the attic of their building. You'll remember that 2 years ago they received a grant for a heat pump of about the same dollar amount for that particular building. Is there anybody here from East Madison? Okay. Any questions or comments on that one?
I wonder what the break-even time is on that. Increasing their insulation. When's the payback?
Depends on what they have on windows and doors.
Yeah.
It just-
So we had the windows and doors next time. Yeah, okay.
And the last one, speaking of cold storage, is the Winslow Community Food Cupboard. They serve many communities in Somerset County, and they provide food to residents in the UT through their mobile food pantry. This project is actually on their site in Winslow, and they are looking to spend $160,000 plus to build cold storage, which will reduce food waste and allow for them to save on electrical costs. They're seeking $15,000 in grants. My only comment on this one is, by rule, you can't gift money from community benefit outside of Somerset County. And so if you wanted to consider something on this, because they do serve Somerset County, you may want to consider a gift or a donation from your TIF funds, because they do serve the UT. So that would be my
I believe we've done that already.
to the tune of $500.
And I'd like a breakdown of how much of their overall thing is spent in Somerset County.
Yep. And I'm pretty confident they're a pretty well-run organization. I believe they can get that.
Yeah. Okay.
All right. Any other questions or comments?
No, thank you everybody for showing up and
Yeah.
giving us their explanations. Appreciate hearing from you.
Just so that everybody's aware, the next step will probably be at the next meeting, December 3rd. All of these will be listed as action items, and at that time, the commissioners will take action up or down on these. They do have the ability to change the dollar figure, so if you ask for a certain amount, they might reduce it. So that'll all take place on December 3rd at the upcoming meeting. I just want to make everybody aware.
What time?
3 o'clock.
3 o'clock.
Yeah. And we'll try to schedule another long, boring presentation.
1,500.
But thank you all for coming.
Thank you.
What do you have in mind?
And usually whatever Patrick's doing. It's long spreadsheets.
We have a slideshow while you're hunting there.
My trip to Wisconsin.
Yeah. Okay, there's no public hearings. The new agenda items, commissioners only. None. Administrator report.
Just a couple of things. I have heard from I've heard that at least one representative from each town in District 2 should be here for the caucus that starts in about 45 minutes. And I just make that time note to say any reports, any discussion is the quicker the better as we move through here. Dave Spencer and I had a good conversation with Jackman Fire Chief Bill Jarvis about his upcoming budget and the use of some county funds. And coming up on resolution number 194, the Alternative Corrections Healthcare Contract. As confusing as it is, this has nothing to do with employee healthcare. This is the healthcare that is provided to the inmates at the Somerset County Jail. And this contract was agreed to in principle in June, and I should have brought it to you in June. And I did not realize I didn't do that until I got an email from somebody at the jail saying, hey, have the commissioners approved that contract?
What's the effective date?
July 1st. So
Of which year?
last July 1st.
Oh, so we're already performing this contract.
We're 5 months in, right? So overall, it's a 3% increase from the previous contract. So
No substantial changes.
The only significant change was they did, within that 3%, they beefed up the mental health treatment that they provide here because we run pretty high in that area. I will be on vacation next week, and so that's pretty much it for my report. So.
Okay. Good to know. Finance reporting.
No change.
No change.
Okay.
He said it.
So you don't make change anymore? He's going on vacation, so he's taking it off.
So I did tell you it would be short, but in regards to the presentation you just saw in regards to health insurance, I'm reading the room that the consensus is to move forward. We don't have an action item on this, but I just wanted to give Patrick the right direction.
But we have to vote on this before the end of the month.
Well, I'm going to have to get a notice signed by you guys so I can submit it to MMEHT.
Before the end of the month.
Yep.
Do we have another meeting this
You
month?
don't have another meeting in November.
So how do we address that?
Yeah.
Back up to agenda items and put it on.
Do you have any documents for them to sign?
Not currently, but Kevin sent me one that all we had to do is put a letterhead on top of it that they've used in the past.
What I would recommend is if you did want to add an agenda item at the end of the meeting, then to move forward with that, then I would get that done today, and when Patrick has the documents to sign, we can make sure that we get at least 3 signatures on it by the end of the month.
Yeah.
So move.
Well,
Second.
so we're going to add resolution 25204
Yes.
for an alternative health.
Maybe 203.
No, 203 is the warrant.
Oh, yes, so it is. Sorry.
So that will be the health insurance. Okay, and we're all in consensus of that addition to the agenda. So with that, Sheriff.
So,
Still here?
extremely busy. Detective bureaus is busy. That's all I'll report out tonight.
And Mike.
Unless you have any questions for me, I'm good.
Okay.
In the interest of our meeting at 5.
Yeah, we got time.
I will just say you do have a resolution coming up, Mike, on a recommendation.
Yes.
And they don't know the recommendation yet on your,
Okay.
so if you just mention that.
Do you want me to address that now, Tim?
Yeah.
Okay. So in reviewing, and I believe Tim included in your packet, reviewing all of the bids up in the RFP, and is our recommendation to go with Hike Ford with the 150 XL, which is the low price vehicle, the lowest priced out of what was bid. They all have the specs that are identical, basically. And the O'Connor vehicle actually allowed us more for trade, but the vehicle was more expensive. It actually came out to be, bottom line, more expensive than what the High Ford bid was.
Okay, thank you.
Yeah, as we looked at it and figuring what we need to use that vehicle for, as far as, we've just been approved for portable generators for purchasing through Homeland Security. We've been approved for portable water filters, where filtration systems could be transported. Cots, blankets, water, everything that we need to transport. We actually, probably no one even here knows or probably even cares, but EMA actually owns an Argo, which we actually store at the Fairfield Fire Station in the center. I think it is a desire to move that back to our location and be able to use it, up here.
I don't know what an Argo is.
An Argo is an amphibious vehicle. It runs on tracks.
Oh.
And so for the snow, it's wheeled. You can take the tracks off and use it on all terrain, or you can take it into the water. So it's basically a duck boat.
Have we used it?
Good for duck hunting.
Yes, we have used it. And actually, one of the places it gets used for, Commissioner, that saves us some money is Yankee Communications actually uses that when they go to some of our towers to work. Mm-hmm. It's a better vehicle for them to get to where they need to, and we're not being charged for them using their own SUVs. So it's actually beneficial to have it. So.
So are you saying that this new equipment we're getting we need this big truck to haul around this new equipment?
We need something that we have the ability to haul cargo in, which we don't have in the Expedition, because the back of the Expedition, to be quite honest with you, and I'm more than happy to show you, there is no back in it. It's all box where the radios and everything are in the back. There is no storage space in that vehicle or any hauling capability in that vehicle.
Do we have a trailer?
No, we do not.
Okay.
Trailer would be cheaper.
Just saying.
Covered wagon.
Yeah.
It's no big secret I'm opposed to the purchase of this vehicle, so I'm looking around for alternatives.
No, and just so that you know, in that vehicle replacement line, I think I looked today, I think somewhat over $48,000 that's currently in that line already for vehicle replacement for EMAs.
Well, I mean, I'll reserve further comment when we get to the resolution.
Yeah, we'll discuss about it then.
Yeah.
At that time. And I'm going to ask for our district attorney.
Well, last time I got to tell you that we had 15 felony jury trial wins in a row in Somerset, and now I get to add 16 because Tim Snyder just won another case. So it was kidnapping, aggravated assault, stalking, 11 counts, and the jury came back guilty on all 11. So continues to do just phenomenal job. And I got to hear from the sheriff today that our newest hire is well liked, that the officers are enjoying, who you got to meet 2 weeks ago. He was here and got to meet you. So, yeah, so just thought I'd give you that happy news.
So good. Thank you. David?
Not for me now.
Yes, sir.
I'm going to update three things. We have an open contract. We had a pre-bid meeting for Lexington snow removal last night with two contractors that came, so we'll have competitive bids on that. This morning I was up in Rockwood at the transfer station. They've got a new retaining wall put in, cement. It was pressure-treated lumber. Previously it failed. One wall actually broke loose. So that's all been repaired. Looks good. I got some pictures if you want to see them at the next meeting. And the other thing we're doing is we started removing the ash. Ash pile was bigger than anticipated, but it is not contaminated, so we can dispose of it locally. And that's going to Juniper Ridge in Old Town with Casella's facility. Started today, but unfortunately, because there's more than we thought, it's going to take about 10 days to dispose of it all, and it's going to cost upwards of $200,000 to dispose of this ash. Now, I called DEP before this. I said, do we really have to? And they said, yes. So it's going away, even though it doesn't seem like it needs to, but DEP says it does, so it's going.
Refresh my recollection on this. The ash is from the...
There's a long-term burn pile.
Yeah, it's been probably 50 years worth of burning brush, lumber, a lot of dry ink on the lakes.
If we wait, does it diminish in size?
No, they gave us the
Why don't we slow roll this for a while and see how much is left?
They gave us an option of spreading it out, but we've got to tarp it, we've got to keep it tarped. It'd be such a hassle. So I figured if it's got to go, it's going. That's my opinion of the situation. So in the next 10 days, it should be gone.
Thank you. Anything else?
No,
That was
that's
3.
it.
I didn't know if you had a surprise 4th. No. Good. Anybody I missed?
Sheriff.
I got the sheriff. He said he had.
Quick.
He said he's just busy. He's
Just busy.
and if he gave us a full report, would be here until midnight.
You know, the sheriff's office investigated that case that Tim just won.
Ah.
I should have
Oh,
said that.
good
His
investigation.
office does phenomenal investigations. That really is why these cases are won.
We have good
Great.
detectives.
Really good. Outstanding. Best in the state.
Somerset County.
Yep.
We lead.
Just as a side, in Kennebec County, you're going through a blitz.
Yeah,
Do you need to do that here?
no. Certainly the court has not seen that as as necessary. There, in Somerset County, because you're talking about fewer people, it's easier for everyone to get together and to talk amongst each other without needing the court to bridge that gap. In Kennebec, there are defense attorneys from all around the state. And so if we're going to actually have serious discussions about cases, it's very helpful to have the court bring everyone together. But in Somerset, it's more, the discussions are more informal. So.
In related news, I'm sure you want to point out that one of our own, Andrew Benson, who started out his legal career as an assistant district attorney in Somerset County and lived for a long time on the dump road in Athens, Maine, is now the U.S. attorney for the entire state of Maine. And we should all be proud of him.
Very proud. Yeah.
There you go.
Yes, very good news.
Thank you. Any other comments or? And I've got everybody except, no, I got you all. Good. Thank you. So now we can go on to new business, resolution 25-194, to authorize the contract with Alternative Corrections Healthcare to provide medical care to inmates at Somerset County Jail.
Second.
Move to second. Discussion.
I had a question. I guess I looked at this and I went, gosh, is this, we're doing this? I don't remember this. And now I find out that we should have done it a long time ago. And this is a 3-year contract?
It is a 3-year contract.
And so I was madly jotting down all these questions, but now I realize they're all entirely moot. But do I understand that this is a 3% increase and it's good for 3 years? There'll be no further increases?
Well, it's a 3% increase each year to the rate that we just ended FY25.
And is that what we've been doing in the prior contract?
This is the second renewal, 3-year renewal of this contract. So ACH, Alternative Correctional Healthcare, they provide healthcare services for 7 of the 15 county jails. And they kind of tailor each of their contracts to the needs of the jail. I believe we switched over 3 years ago when the 2 providers, one of them dropped out. So at the time, it was kind of like the only provider for these services.
So who's doing the other 11 counties?
Well, again, it's the other 8 jails.
Okay. Yes.
So the Cumberland and York use Armor Health, which is a large company out of Miami, Florida, and Kennebec and Androscoggin use a company called Psychiatric Services, which again is another corporate. And the cost associated with those is about twice as much as what we pay.
And our contract includes not only medical service, but mental health services also.
Yeah.
So it's an all-inclusive contract.
It seems like a really big number, but I assume it's always going to, I was sort of wondering, how does this compare with the food budget at the jail? Is this?
Food budget's about $400,000. Medical care to inmates is about $1.8 million.
It's about $6 a day to feed.
It's the second largest expense outside of personnel. And that's the same for every jail.
And we also pay for any kind of hospitalizations or off-premises medical care.
That is correct. It's because a person upon arrest loses their main care benefits. So if a person has main care, as soon as they're arrested, they lose it.
So the total number
Gets suspended.
Yeah. So our total healthcare costs include what we pay our local service providers plus this contract. Would be what we're spending on medical.
No, because this service provider covers the cost of hospital care, which is one of the reasons that our costs.
That's my question. So that
our costs are higher. Right.
So when we have to take Joe Schmo down to the ER,
right?
They pay.
It's the coverage there is part of the services in that contract.
So we don't get a separate bill from our Reddington Fairview.
That's correct.
Okay, well, that's good.
And
so if somebody has, pardon me, if somebody has a severe $50,000 injury, that's covered by this, or do we get billed for that separately?
Well, we don't get billed for that separately, as far as I know.
no, that's part of the contract. Takes care of that. One of the issues is that Skowhegan Hospital has higher rates than they don't accept because they're critical care. They don't take main care rates, so that drives up our cost. So if there's a non-emergency, we try to take them to we take them to Waterville, trying to keep those costs down.
But why do we care? Or is that in this contract?
No, we should care because if the provider, who is a for-profit company, has to pay more, we're going to see the other end of that the next time the contract comes around.
So they just build it into the contract.
Right.
Okay.
In respect to the Medicaid, we asked for an exemption at one point. Is that going anywhere?
So the state of Maine has asked for an 1115 waiver.
Yeah.
The federal government has to approve that. It has gone through all the processes in the state. It's essentially waiting for federal approval. Even if it gets federal approval tomorrow, it'll be 2027, 2028 before we see any benefit of that.
And we've been waiting for a couple of years already.
It's a
Well, we just turned in our paperwork too, right?
The state did, yes.
Yeah.
We say we say the state.
I think there was a loggerhead at the state, between the state and the feds for a while. So. And with that, has there been any more discussion with the other 7 counties about doing a group?
Actually, we had a conversation today about that with the Department of Corrections during the Jail Standards Council meeting. I think the Jail Standards Council is going to get a study because we have some expertise in Waldo County, in the Commissioner Kelly, who spent 30 years of his career reviewing medical contracts. So we may have that commissioner put together a proposal to review all of the jail contracts for medical care for inmates and come to some conclusions.
Good. Thank you. Any further questions or discussion on Resolution 25-194? All in favor? Thank you. Resolution 25-195, to award a bid for a vehicle for emergency management department.
Second.
And that would be for, as requested, the Height Ford 2026 F-150XL for $46,821.
The one that was discussed earlier.
Yep. Just want everybody to hear this. The trade is $12,000 and the net cost is $34,821. $34,821. Discussion.
Well, like I said, I'm opposed to this. The existing vehicle is relatively new. It has 50,000 plus miles on it. I know we have money in the budget to buy vehicles. We've been buying vehicles with ferocious abandon. Really started a number of years ago when they were so hard to get. Whenever we could get one, we'd grab it. But I understand it's important to have a functioning vehicle for emergencies, but it seems to me, this is a car that is, in my book, if it was in my garage, I would consider it new. So it seems to me we should, keeping the taxpayers in mind, I just don't think we should be spending money on vehicles that we don't really need and we can get by with what we have. And I also think the trade allowances on these bids was ridiculously low. So I just think, I've got a 3-year-old RAV4 in my garage that has 62,000 miles on it, and I view it as a new car. So when I see a vehicle with less than that on it, it seems to me it's in great shape, and I don't think this is a take-home vehicle. Am I right on that?
Yes.
Yes, it is, or
yes,
I'm right.
No, yes, it is.
And is that necessary? How many times do we have call-outs?
It depends. I can't give you an exact number, John.
Well, is it once a week or once a month, or
we could go months without having one, or we could have multiples. Well, but it doesn't. It isn't a matter of the. The reason you have this in front of you is because I thought I was following the process that we had discussed.
Yeah, and I'm not.
So I'm not doing this because the vehicle has low mileage or high mileage, or it's a 7-year-old vehicle, or whatever. I'm just doing this because I could have waited until January and somebody else could have taken care of this.
Yeah, I'm not faulting you. I'm not faulting you for trying. I just think it's something we don't need and it's expensive, and we shouldn't be spending money on it. Simple as that. That's my position.
And I'm going to kind of add on to what John had said earlier about having a trailer. Does it have a trailer hookup on it now?
Yes.
Okay, so we could put a trailer to it and bring things around. So there's that.
We could even have a trailer with pre-positioned safety equipment on it, so all you have to do is hook up and you're ready to go.
Right.
So.
I'm on the same mindset as Gary Sherrill, so I don't think at this point in time, my thought for reading this tonight was, let's look at this again in a year and see where we're at.
Cool.
Moot point.
Okay. So we have a motion on the floor to award the bid for the vehicle as stated. Is there any ayes? Seeing no ayes, are there any nays? And it's a unanimous nay. So we'll pass over that for this time being. Resolution 25-196 to authorize the hiring of Sabrina Ferranti as Deputy Emergency Management Director for Somerset County. My apologies if I mispronounced.
Second.
Discussion? All in favor? Go. Resolution 25-197 to approve paying the following matching grant awards from community benefit funds. Athens Community School for cross-country ski, Palmyra Park Boosters resurfacing courts, Bowman Center, St. Albans Emergency Efficiency.
I move that we approve the paying of the funds as are indicated on the agenda.
Second.
Motion moved and seconded. Is there any discussion? Is there any concern about the painting not being done in Palmyra?
I'm not.
I was just making that point, though.
Those are insinuating circumstances that are probably out of their control. So.
Thank you.
Okay. No more discussion? All in favor? Resolution 25-198 to accept the resignation of Holly Mullen as Judicial Assistant for Somerset Judicial Marshals.
So moved.
Discussion? All in favor?
Ready?
Go. Resolution 25-199 to authorize the hiring of Bill Shaw as judicial assistant for the Somerset Judicial Marshal.
Is this the county ACO?
All in favor? Yeah. Are you discussing this?
Huh?
Are you discussing this motion?
Well, yeah, I am. I was wondering whether this individual was...
It's the same individual. He's also a license or a deputy.
Oh, okay, great. I'm just curious.
So, Resolution 25-199. Okay, thank you. Resolution 25-200 to authorize the hiring of a legal secretary restitution clerk in Somerset District Attorney's Office.
Second.
Moved and seconded. Discussion.
I would just note that this is Kelly Stratton, or Staton, and she comes with experience from the Kennebec office.
And this is an existing position?
This is an open position that we've been trying to fill.
Not a new position.
Right.
Newly created.
Any discussion? All in favor? Go. Resolution 25-201 to authorize the promotion of Corporal Travis Oakes to Sergeant at the Somerset County Jail.
So moved.
Discussion. All in favor? Resolution 25-202 to accept the resignation of Linda Fortin as Communications Officer with the Somerset County Jail.
Corrections officer, right? Is that what you said?
Corrections Officer.
Yeah. Second.
First, second, discussion. All in favor? Good to go. No capital expenditures, unorganized territory, warrants 25-203 to approve the treasurer's warrant for general funds, Somerset County Jail, unorganized territories, TIF tax revenue, and TIF community benefit for a total amount of $960,566.15.
Second.
Discussion? All in favor?
This is the fire trucks and the TIF and the...
That is in those two TIF accounts, yes.
Also, the tip payment back to Blue Sky West is
Right.
$300,000.
Right.
Got it. Thank you.
Okay, good. All in favor? All right, we're good. And then we have Resolution 25-204 to approve the Acadia Health Insurance proposal.
So moved.
Second.
Discussion. All in favor? Good to go. Miscellaneous discussion items, commissioners only?
Was that motion with dental or just the health insurance?
I think it was as presented, but
Yeah,
I can...
with the dental.
Yeah. In conformity with the figures presented at an earlier occasion in this meeting.
Miscellaneous discussion items? We're all set. Thank you. And now we're going to recess to execute documents.
Going to
Yeah, this one is.
Oh, okay. This is very exciting. Because I heard the deputy secretary there, double puncher.
Yeah, they're looking for a replacement for her in the deputy position.
It's still out there. We'll get on there. I won't forget.
Because I wouldn't be there unless I did.
Buzz Lightyear.